How is gout diagnosed with joint fluid analysis? Imagine a tiny needle helping doctors solve a big puzzle in your joints. That's what happens during a procedure called arthrocentesis, where a healthcare professional uses a needle to gently draw out fluid from the affected joint. Before the procedure, a local anesthetic is applied to numb the area, making it more comfortable. The amount of fluid collected depends on the size of the joint and what tests are needed. Once the fluid is obtained, it's examined carefully. First, the doctor looks at the fluid's appearance, checking its volume, color, clarity, and thickness. In gout, the fluid often appears cloudy and less viscous than normal, which is a sign of inflammation. Normally, joint fluid is clear, straw-colored, and thick like egg whites. Next, the fluid is examined under a special microscope called a polarized light microscope. This is where the key to diagnosing gout is found. The microscope can reveal tiny needle-shaped crystals called monosodium urate crystals. These crystals are negatively birefringent, meaning they change the light in a specific way that helps identify them. Finding these crystals confirms the presence of gout. The lab also counts the white blood cells in the fluid. In gout, the number of white blood cells usually ranges from about 2,000 to 50,000 per cubic millimeter, indicating inflammation. The type of cells present, mainly polymorphonuclear cells, supports this but isn't exclusive to gout. Sometimes, the fluid is tested for uric acid levels, but this isn't as definitive because uric acid can be high in other conditions too. To rule out infections, the fluid may also undergo bacterial cultures and gram stain tests. These help ensure that the joint inflammation isn't caused by bacteria. The overall diagnosis hinges on finding monosodium urate crystals in the joint fluid. This is considered the most reliable method and is the gold standard for confirming gout. It helps distinguish gout from other joint problems, like infections or other crystal-related conditions such as pseudogout, which involves different crystals. So, in essence, diagnosing gout with joint fluid analysis involves safely collecting fluid from the joint, then carefully examining it under a microscope to look for those telltale urate crystals. Always remember to consult a healthcare professional for proper diagnosis and treatment options.